Welcome to Adapting Class, and thank you for following the series where this is number 6. We got to keep going. I like the spirit, eye-charging questions, fundamentals of nursing. Let's get to it. First question, straightforward, right? What do we have? This is an ethics question. A nurse is assessing a client's schedule for cholecystectomy, right? In the perioperative unit. This is a preoperative question. After verifying the client's signature on the consent, the client said, I don't want to have the surgery anymore. What is the next best action? Simplified. Patient said, I don't want to have surgery anymore. What should you do? Keyword, let them do whatever they want to do. Don't worry, everybody goes through this anxiety. This is not answering the question. You are assuming he's anxious. He said he does not want to do the surgery anymore. You should not say that's everybody. He's not everybody. He is whatever he is, Mr. So-and-so. Unfortunately, the consent is already signed. That's negative. It's not true. Even if it's signed, patient can stop it at any time, 1 second before you take them to surgery. Okay, let me inform the surgeon. That sounds reasonable. This is a simple procedure. You will be done no time. He does not care whether it's a simple procedure. He said he does not want anything to be done. You have to honor his wishes. He has nothing in the question that tells you he's not competent. Number 2, what do we have? A nurse reviewed the client's lab value. Sodium is 145, potassium 4.5, calcium 14, chloride 105. Do you see any abnormality there? Calcium of 14 is too high. So the question, all these questions they've given you, all they have to say is, what do you see when you see hypercalcemia? A lot of calcium too high of 14. If it's too high, you're not going to see it. Chopstick sign is supposed to be low. Anthony supposed to be low. Hyperreflexia, right? What do you think? Too much calcium in your system, your reflexes is supposed to be low. You see, all these things are all outgoing symptoms. That means you see that when the calcium is low. This and that, you see them when calcium is low. The only symptoms you see when the calcium is high is constipation. Therefore, this is your right answer. Number 3, what do we have? What is the next best action? Your best action. Give me your best action. And next is doing intake assessment for a client scheduled for what? Hysterectomy. He's going to have hysterectomy. The client reports stopping the daily Coumadin 2 days ago. We have a problem. Coumadin has to be taken at least 5 days. You got to stop it. If you just come into surgery and you get a hysterectomy, that you're going to bleed, yeah. No need for the nurse to document finding. You can tell the charge nurse, but the charge nurse has no authority to cancel the case. You notify the provider. You don't recommend protamine sulfate, test taking skills. Protamine sulfate is for heparin. If you give it to Coumadin patient, it's not going to do anything. So this is strategy to answer the question. Break down the keywords from each question, answer choice, and eliminate them. So that's number 3 down. Number 4, interesting question. A nurse is doing intake assessment for a client schedule for hip replacement. This one is getting hip replacement. Which of the following statements should be communicated to the physician? Well, I don't know what statement it is, but you're doing hip replacement. Which of those you got to tell the provider? Well, patient and CPAP, okay? Patient say, I can't wait to walk without pain on my hips. No, it's okay. I drink 4 beers a night, maybe. I get upset stomach when I take opiates. So you got to break it down, step back and see if this is normal finding. If not, there's no need to report it. You get stomach upset when you take opiate. Everybody does that. No, that's normal. It's normal side effect. Nausea, vomit. You brought your CPAP, yeah, so that when you're sleeping for your obstructive sleep apnea, you can help with that. I can't wait to walk without pain on my hip. Yeah, after the surgery, you should go. But drinking 4 beers a night is a problem. You're going to get withdrawal. So we can, if we know we can preemptively take care of this patient, put them on diazepam, replace their electrolytes, and be expecting them to go into seizures. So we can preemptively treat them. That's the key. Number 5. Which of the following indicate effectiveness of the medication? That means it's working, right? A nurse is caring for a client with CHF prescribed bumetanide. Which of the following indicate effectiveness of the medication? So if I give you bumetanide, it's a loop diuretic. Okay, you're going to lose a lot of fluid. Class 3 edema, well, the medication is not working yet. That's why you have class 3 edema. Your saturation is 95 on 4 liters. Yeah, you're still not ready yet. Keep getting less and dry you up. 600 ml, the last hour of urine. Oh my God, that's an hour 300. That's excellent. I like it. Pink fluid sputum, they have pulmonary edema still. So that's not shows that it will be effective. So the number 3 is the right answer. And number 6, what should the nurse expect? A nurse is caring for a 3-year-old client present with a hemoglobin of 6, whose parent is refusing blood transfusion for the child due to religious belief. You have a child, 3-year-old, parents said no to blood transfusion if you don't need it. It's a life-saving technique. What do you think? What should the nurse expect? Court order, honor family wishes, refer the case to the hospital ethics system, go ahead with the transfusion anyway. So this is the problem. The parents said, what? No, I don't want it. So you have to go through the steps. The first steps is go to your ethics system. The people over there will deal with this problem and they will rectify it. If not, then you go to court. But that is the way you go through the process. You don't honor the family wishes. So for now, let's refer the case to the hospital ethics team. Another question, the same thing. What is the next best action? A nurse is caring for a 10-year-old with acute appendicitis in emergency room. The parent does not want surgery and want to take the kid off. The same thing. You have acute appendicitis, and the children, the parent does not want surgery to be done. Okay, he has acute appendicitis. They don't want it to be done, which is really bad. And so what do you want to do? You, the nurse, you fall into situation. So I told you the first process, you go through the what? The ethics team, then they go to the judge, the court, and everything. But so far as I intentionally put this question there, the first and the most important thing you can do is to assess their parent. If there are any parents who refuse treatment, find out what is the understanding of the procedure you're going to provide. If you're giving them all the necessary information, they said they're still going to do that, you talk to the ethics team. After you talk to the ethics team, you go to your and they still cannot take it, the parent doesn't want it, then you go to court order. So you go through this process. For this particular case, the beginning, we assess the understanding before we go to the hospital ethics before court. So this is the right answer. So the scenario can change and what they're expecting based on how they frame the question. And number 8. A nurse is caring for a client with leg edema who need thigh high anti-embolism stock? Which of the following measure is accurate? So you just underline it. This is just a straightforward question, but it can be difficult. Thigh high. That means if this is your leg, okay, and your knee is here, the thigh is all the way here. So I got to go all the way up. Which of the following is accurate? You measure it from the bottom of the heel to the knee. It's too short. From the Achilles tendon here to the popliteal fold. Bottom of the heels, okay, to the fold of the buttock. Achilles tendon to the fold of the buttocks. So the red answer is bottom of the heels all the way to the fold of the buttock. This is the way to measure thigh-high anti-embolism stock. Okay. Achilles tendon to the popliteal folder is thigh knee. No, knee high, sorry. Knee high. And so that's not what we're talking about. We're talking about thigh high anti-embolism. And number 9. Client present to the emergency room after ocular trauma. Exams reveal hypemia. Which of the following actions by the nurse is very concerning? Management of hypemia. This is a serious emergent procedure, an emergent case that you need to intervene. The hypemia, if it is the eyeball, okay, there's blood sitting here like that. It's just pure blood. So it can increase intraocular pressure. And therefore, you want to prevent anything that can do that. You put a high patch to the affected eye that is acceptable. Encourage the client to avoid straining to prevent increase in ICP. And supine position is never good. So which one action is very concerning? Put them in the supine position. Recommend Tylenol acetaminophen for pain. Yeah, so that's great. And the last one. The nurse supervises a UAP, as usual. Which of the following delegations are appropriate? Like I said, the UAP do things that they don't have to think too much. But how would you apply that statement? Teaching on, there's a word, teaching is completely gone. They don't monitor anybody's function unless it's their own. Replaces SCDs after ambulating. The patient work, they come in bed, you just put the SCDs on. There's nothing wrong with it. And I said swallowing during oral intake. Well, I have to check, but that is not right. They cannot do that. How can the UAP assess somebody is swallowing? You can't, that's like the worst thing you can assign it for. You can't assign assessment. They don't do any assessment. Assessment is done by the RN. So they don't teach, they don't monitor, they don't assess, they replace something they took SCDs that is broken. So that is the right answer. Thank you for sticking around for this short part 6. All the best of luck and keep charging. Take care of yourself. Thank you for watching.